Following up on the increase in norovirus cases, it's more commonly referred to as the stomach bug, and health officials continue to track an uptick nationwide.
Yeah, it's a really nasty virus. ABC Action News reporter Larissa Scott spoke with local doctors about the rise in cases and how to avoid getting sick. Larissa's in the studio now with the details. Good morning, Larissa.
Hey, good morning, Deanne, Andrew. And doctors tell me it is common to see cases increase this time of year, but they are seeing much more than usual right now. The dreaded norovirus or stomach bug is once again making its rounds.
Norovirus is really the most common cause of this viral gastroenteritis.
It's an extremely contagious virus that's known to take down entire households.
It's terrible because it starts with one person and then slowly everybody starts getting it. And you are so sick.
The CDC is tracking a rise in norovirus cases all over the United States. The red line on this graph shows that spike, and it's still climbing.
This is remarkably transmissible.
Health officials are looking into the possibility that this steep wave is being caused by a new strain. Norovirus causes intense gastrointestinal symptoms like nausea, stomach pain, and violent diarrhea and vomiting.
I've heard it referred to as the two-bucket illness, like one for up here and the other for down there. And the symptoms can be pretty intense.
You can also have a low-grade fever, and people can be contagious even after they're feeling better.
When people have norovirus, the symptoms go away relatively quickly, but they can be infectious for a couple weeks afterwards.
Don't prepare someone else's food. So really kind of stick to yourself for at least a few days afterwards and even up to a couple weeks.
If you do get sick, doctors urge you to stay hydrated with water and electrolytes, even if you can't keep anything down. Dehydration is the biggest concern.
And you do a sip or two every 10 to 15 minutes. And that one should help so that you don't feel overly nauseated, but it would help to keep you hydrated.
Norovirus is not airborne, but it is spread through your hands and surfaces. You can also get it from contaminated foods like shellfish, leafy greens, and fresh fruits. The virus can linger on objects for days. It's most commonly spread in restaurants, cruises, and schools or daycares.
It's really hard to get rid of.
Once it's in your household, doctors say you should try to isolate whoever is infected and use separate bathrooms if possible. While there isn't currently a vaccine for the virus, drug manufacturer Moderna is working on one in a clinical trial right now. But in the meantime, health officials say the best ways to protect yourself from this outbreak are by rinsing your fruits and vegetables, cook shellfish thoroughly, and wash your hands often with soap and water.
Frequent hand washing and disinfecting with bleach is going to be the best way for prevention.
And that disinfecting with bleach is key if someone in your household is sick. And this is really important to remember. Hand sanitizer does not work against norovirus, so you have to wash your hands with soap and water.